What I would like to do is actually introduce you to Rich, who is a person who has had a neuroendocrine tumour. So I'm just going to bring up Rich's slide. And Rich, are you with us?
Yes, can you hear me, everybody?
We can. Well, I can hear you. So I'm thinking that that's a good sign. That's a good start. So, Rich, I'll actually get you to introduce yourself. All I know is just a small amount about you, but I'm sure that everyone else would like to hear your story. So.
Okay, thanks, Kate. Well, my name's Rich Johnston. I've in my 13th year now with NETs and carcinoid syndrome. I live on the Gold Coast. I'm 49, wife with 2 kids, and just hopefully won't be too confronting. I've just explained my whole journey and where we're at now. So if anyone can't hear, just let me know and I'll go to speakerphone. Back in 1998, I was feeling a little unwell, getting cramping and abdominal pains with subsequent bouts of diarrhoea pretty much daily. And I initially put it down to lifestyle choices, as I was drinking wine nightly and probably not eating as well as I should have been. I think we all do that at times. Little did I know that the impact of these health issues were going to pretty much dramatically change my life forever, as I knew it. My diagnosis was in September 99. I went to my GP at the time and he requested some bloods to be done. There were some irregularities found. Then I was off to do an ultrasound and it came back that I had metastases on my liver and a bowel tumour present on my large bowel. I then went for a liver biopsy and this was confirmed as carcinoid syndrome. 3 key discussions transpired in that first 12 months that took place that forever stick in my mind. The first one, I saw a different GP for a non-related illness back in 2000, and after I told her that I had carcinoid syndrome, she said it was an old man's disease that usually occurs in men aged between 60 and 65 primarily, and I was unlucky to have gotten this illness. This didn't really help me deal with the disease that well, thinking, well, how unlucky am I? But we all know differently now that it can affect anyone. The second conversation was with my first oncologist. He told me that I'd likely had only 3 to 4 years to live based on the medical evidence of that time and trials that had transpired. I had 2 appointments with him until he transferred me to my current oncologist. At that point, I then decided not to change my lifestyle. There was no cure, very little known about the disease and little research being done. I honestly believed I was going to die from this disease before I reached the age of 40 or thereabouts. My partner at the time and I ended our relationship almost right away due to a lack of compassion, understanding and support. And I was quite happy to be able to deal with this alone at the time anyway. The third conversation was with my oncologist when I asked if they could do a liver transplant, and the answer was an emphatic. They wouldn't waste a good liver on you. This pretty much floored me so much that I just left it at that. A few years later I asked again and it was then explained to me that as my liver cancer was not a primary cancer, then transplants are not possible. I guess that's the difference between someone like Darren Hinch, who got a liver transplant, and myself and some of you other sufferers out there. I'll just progress my slide. A bit about my family. I met my wife Donna in August 2001 despite my protestations based on my illness. We decided to become a couple and moved in together along with our son Jackson, who was 4 at the time. On the 23rd of April 2003, our daughter Taylor arrived just 3 weeks before my liver resection, and I had plenty to live for at that point in time, as opposed to my attitude a bit earlier on. And we married in October 2004. I guess having them in my life and getting some much needed emotional support has been life-changing. Without it, I probably would have struggled a lot more than I have, although it has been an epic battle in itself to keep it all together, both mentally and physically. It's a pretty tough disease, as some of you know. In October '99, I had my large bowel resected. During post-op recovery, a doctor at Gold Coast Hospital decided that the tube down my throat was due to come out then and there. I said I felt it wasn't ready, but he insisted at 2 a.m. that morning. What occurred next was horrific. He extracted the tube rather quickly, causing a vacuum effect, and the next thing I knew, I was vomiting black liquid from my stomach that was destined to exit from my rear end. This vomiting continued for 2 days until I did get some respite, and despite several attempts to reinsert the tube filing, which only served to strip my throat, I was back at work within 3 weeks and playing golf again in 6 weeks. Made a pretty good recovery. Life continued on as normal after that, but the symptoms continued on, gradually worsening, but with less of the cramping. So I had a little bit of a win with that operation. The second operation was in 2003. I started to get hot flushes, a lot of upper abdominal bloating and associated liver pain as the liver tumours slowly grew larger. The largest was about 3.5 centimetres in diameter, but I did have numerous tumours at that stage. The diarrhoea was starting to increase in frequency, and I was starting to go around 10 times a day. The carcinoma symptoms had well and truly kicked in by then. I then had my second operation in May 2003. This was to resect the left lobe of my liver and undergo ablation of remaining tumours on the right lobe of my liver. The surgery was 6.5 hours long, and I was in intensive care for 2 days. I doubt I will ever feel so sick in my life, whatever happens in the future. I was green. Amazingly, with well over 60 metal staples in my stomach, I was back home on day 7 after the surgery and doing well. I removed the staples myself with the tool the hospital provided me. Well, it was fun. This time it took 3 months to return to work as I was pretty well immobilised while my stomach healed from the surgery. My stomach muscles had been cut in both directions and has never really healed that well. To this day, I really struggle to get my shoes and socks on, and often my ribs stab my liver when it is distended, and that brings me undone for a couple of days when it happens. My kids often do it for me now. Sometimes being independent is just not worth it sometimes. I'll just talk a bit about my working life and some of my other illnesses. In 2002, I started working for Centrelink, helping others in our community that were in need of assistance. I found it mentally demanding but personally rewarding at the same time. I really enjoyed my time there. The pain from my liver had gotten quite severe, both from the liver operation and the bloating. My girth would expand up to 12 centimetres in circumference daily, and I was taking painkillers at work just to get through each day. My employer invested in a sit-down, stand-up workstation, which was great, and I was able to stand at my desk when the stomach pain was starting to come on, so I was able to manage my comfort a lot better. In May 2005, I was diagnosed with type 2 diabetes, so I was just taking tablets for that. And in September of the same year, I suffered a major heart attack whilst at work and had 2 stents inserted in my heart and suffered a little bit of heart damage. One of the veins was 99% blocked and the other 80% blocked, so I was a bit lucky to get through that one. By 2006, Centrelink had set me up at home and I was working full-time there, but the big loss in my life was the social aspect that work gave me, so it just wasn't the same as going to the office to work anymore. It was a bit isolating. Within 12 months, I was working the phones from home, calling other sick people and their carers to see how they were going and whether they needed further assistance support from other community groups and agencies. probably not the best work I could be doing given my own situation. After 6 months of doing this work, I started seeing a psychologist after struggling with the work I was doing. No one was ringing me to see how I was going. I felt abandoned all of a sudden. But it really got me back on track, and my attitude started to become more positive. I started to go fishing and stand in the surf at 5 a.m. in the morning before work. It was a huge help to clear my mind. In early 2008, I could no longer sit at a desk for more than an hour without stomach pain, and that is still the case today. I applied for retirement, and the specialist acting for the public service super scheme literally told me off for not doing this earlier. So I retired in July 2008, and I'm pretty much unable to work again full time. I hope to change that if there's ever a chance that the treatment I'm getting at the moment is successful. I have my family to support, and I went as far as I could with working, despite rumblings from my brothers and sisters that I was giving up a good job and income as they live interstate and could not understand or see my daily struggles. This added to the pressure to keep working as long as I could. Amazingly, after retirement, I went 2 years without spending a night in hospital. I knew I'd made the right decision, and my body had told me so. The thing with having this cancer is that us sufferers don't often look sick, so the stigma of pretense weighs pretty heavily on us. One family member thought I was the boy that cried wolf, always sick but never looking or behaving sick. Being courageous and resilient sometimes has its drawbacks. In my 5.5 years at Centrelink, I used about 300 days of annual leave and sick leave, and I even bought some annual leave just to be in hospital for pain issues. I usually had a week in hospital every 3 months or so. I never got to take much in the way of a holiday. Life was pretty miserable in that respect. After retirement, I started mowing the lawns for my neighbours to stay fit, but I would get quite nauseous through the hard work, and my legs and hips would start to hurt as well. I eventually had to give this up altogether and this becomes a factor later on as to why that happened. I'll just skip a slide and pop back. With carcinoid syndrome, I hope this is not too confronting. The symptoms I'd experience are flushing, which I would usually get hot flushes when drinking alcohol, and this would last about 2 minutes. I'm not as frequent with this symptom as others, but it has increased over the years to not involve alcohol when it does occur. With diarrhoea, I went from cramps and opening my bowels 5 to 10 times a day in 1998 to going 20 to 30 times a day and suffering bleeding at my worst. Become very chronic and disheartening that this was ruining my quality of life because I couldn't go anywhere far from home unless a toilet was available, and I was getting mixed results from gastrostop and other blockers. The bloating, as you can see in the slide, I would bloat up and look like a pregnant woman at full term in a matter of 30 minutes. The liver and abdo pain associated with this bloating is very severe, as you can see when you lie on your back. It normally would flatten out, and my stomach's quite elevated in the pictures I've provided. The bloating, as it's severe, would only subside through taking painkillers and passing wind over a long period of time. I could never work out why this was happening or put it down to anything I ate or drank. It's very frustrating and debilitating. The treatments I've had and some injuries that I've suffered along my journey of 13 years. In 2007, I went on Somatuline and lanreotide injections for about 6 months, but my bloating and liver pain was at its worst, and my oncologist decided it wasn't really working for me. We agreed to give it a rest and see if things subsided, which they didn't. In 2007, I suffered a massive pain in my right hip and was hospitalised for 11 days. The doctors told us they suspected bone cancer. It really felt like a jackhammer was being unleashed onto my hip bones. I didn't sleep for 4 days because of the agony. They performed every scan imaginable and found nothing and said it was referred pain from my lymph nodes. But there was no evidence to confirm that. And I went home without answers again. Just double check, go back there to my children there. In September 2008, I was diagnosed with cancer of my testicles with tumours on both. This was from the carcinoid spreading. I was devastated once again. Could this get any worse for me? Well, it did. No. I had a right orchidectomy, which left me with one left. Bit of a joke. This was done through a urologist, and when I advised my oncologist of what had occurred, he said it was not possible and asked for the lab results, which confirmed that it was in fact carcinoid. He had trouble accepting this, and that made two of us. This was a further blow to my self-esteem, having already lost my ability to work. I soon after developed gynecomastia in my left nipple, so now I had to deal with the issue of growing breasts. The pain soon subsided, my testosterone kicked in and I returned to normal. That was a hallelujah moment. Everything still works as it should and no man boobs for me. It's a huge relief. In the same year, I ran at my daughter's school athletics carnival. In about 5 seconds, I had torn my right hamstring and left the muscles almost off the bone. The back of my right leg was black for 2 weeks from the bleed and bruising. So I had lots of physio and rest. Seemed to heal this to about 90%. I had no other treatments for this disease up until 2012 other than half a dozen injections to quell the symptoms. It's a long time without any help. By February 2011, my restricted movement and ability to keep the house properly while my wife worked full-time and my frustrating mood swings ended our relationship. By April, I was suffering more and more from this loss in my life, and my symptoms were increasingly bad. My only support was starting to have had enough of me and the illness I was carrying, and we lived apart for 8 months. We always loved each other, but she was starting to believe the boy who cried wolf story as well. Okay, might be too long. And was slipping into a depressed state herself. This disease was causing way too much unhappiness and negativity. In September 11, I complained to my oncologist about my hip pain. Both sides, it was limiting my movement after sitting down, and when I stood, I was unable to walk unless I stretched my whole body for a minute, and then I could limp away. It was causing me continued duress and pain, and the bloating had got to its worst ever. I asked him about the meds I was taking to see if this could be from any side effects, and he doubted it. I did research on the drug Actos, which is a diabetes medication, and found my symptoms were exact to another Actos taker. I stopped taking the drug without medical advice, and within 2 weeks the pain locking the position had almost completely stopped. It continues to improve. I asked my oncologist about Certex therapy, and he arranged for me to see a specialist in Brisbane. For an appointment, I was told it was $25,000, which I didn't have, so I had to cancel that way forward.
Rich, it's Kate speaking from the Cancer Council Victoria.
Yes,
I'm so sorry for breaking in, because this is a really compelling story, and you know, I'm sure we haven't heard even a small percentage of what you've been through.
Yep.
I am just mindful of the time, and I wondered if I could ask you just before we move on to the next section, you know, if there was some advice that you would give someone, you know, coming through this experience, you know, someone who was coming along, what would you tell them? You know, what advice would you give someone who was you know, coming along fresh in this journey?
I did have this here, and it's, I think it might even be on one of my slides. I'll just jump forward a bit from my history there. I'll just touch on a couple of slides as I go. As you can see, that's my gallium PET scan from March this year, so you can have a quick read of that. I guess for other patients out there is they don't take no for an answer, and always seek to get some answers, because they are out there. I went 12 years without them, but in the last 6 months it's been amazing what I have been able to find out. The other thing is, if you're offered something from your oncologist and you're not happy with it, you need to push to get the right scans done for yourself. Make sure that that the two professors have touched on the treatments that are available. I didn't know any of these in my first 12 years, so I would have done things a lot differently had I had that knowledge. And thanks to the people I talk to on Facebook and stuff, without them I probably wouldn't have found out what I know now, and I wouldn't be receiving the treatment that I am now. So there's my scan there with in colour, so you can see I've just highlighted one tumour on my hip bone that I never knew. Well, it's in my iliacus muscle that I never knew I had, and without this scan it would never have been picked up, and that's the reason why I've been struggling to move and mow lawns and everything like that. So the gallium PET scan really is the gold standard scan. So if your CT scans aren't showing up where you're getting pain, then I suggest you push your oncologist to see if you can get a gallium G68 PET scan. At the moment, I'm undergoing lutate therapy at Royal Brisbane Hospital. I'm on 4 cycles. After my first dose, I had some blood tests, and my liver function has turned around 80% on some of those receptors that they're looking for. So it's been fantastic so far. I've had 3 painkillers in 8 weeks. I don't take anything for diarrhea. I've returned to normal. I don't get any more bloating, no flushing. So I'm looking forward to doing my 4 cycles and then seeing what the results are when I get my next scan done, and also the turnaround of my bloods has just been amazing. I'll wrap it up. If you'd like to get the rest of my story, you can get that off Simone or myself. I can send it to you. Thanks for listening to my journey. I hope this troubling time I've had can be turned into some good. I have the strongest will to live. I've rediscovered the belief and support for my loved ones that was almost lost. I spend a lot of time talking to other sufferers and make sure that they give themselves every chance to survive without suffering, and push them to get the best access they can do. Help us. We're all in this together now. I no longer feel isolated and lonely living with this dreadful disease, and we're all learning from each other. So I hope I've helped someone tonight.
Well, thank you so much, Rich. And
that's okay. We've got a few things that people need to do. Just there, they can have a quick read of.
And perhaps we'll leave that slide up there, Rich, while we just move into, and we've just got a few minutes where we can ask particularly Professors Rodney Hicks and Nick Pavlakis some questions. But I just do want to thank you so much for, sharing your story, because I think, we can listen to medical experts and, listen to, look at graphs and look at lists of treatment. But for me, it becomes very real when I'm hearing a story like yours. And I just, I really admire your perseverance through all of this. And I really thank you for your honesty when you were sharing too. I think you're very courageous, touching on those very raw emotional nerves. And obviously this has been a really huge thing for you over the last 13 years, so I really do appreciate it. And I think one of the things that Simone from the Unicorn Foundation and myself would like to explore with people, at the end of this webinar and beyond, is perhaps some ways that we could even, step up that support for people in Australia with neuroendocrine tumours. So, I really do appreciate that. So thank you. So just before we go on, there were some questions, and I'm going to leave this slide of Rich's up on the screen, so you can have a little, I guess, as we're putting some questions forward to our experts, that perhaps you might have a look at those words that Rich has prepared for us. But I was wondering if I could ask a question of Rod. Rod, are you with us?
Yeah.
Fantastic. So one of the questions, and we did get a lot of questions through, and we've got just a few minutes left, but I wondered if you could just very briefly touch on what carcinoid...
Can you hear me?
Yeah, we can hear you.
Sorry.
So we're actually wanting, one of the questions, what exactly is carcinoid crisis, and specifically what the dangers of those, if there's any triggers, whether it can occur in the course of everyday life, and what one should do if it does. So that's like 4 questions in one, and I wondered if you could give us a very brief, in the box wrap of what carcinoid crisis is.
I guess it's just an exaggerated episode of the symptoms that people get all the time with carcinoid syndrome anyway. It's an outpouring of serotonin into the general circulation, and that leads to blood vessels, not only in the skin and gut dilating, but most of the vessels in the body dilating very rapidly, opening up. And because of that, you get pouring of fluid into the bowel, as well as a loss of blood pressure. And so the main effect that we see is a very marked reduction in blood pressure, and people can faint or become semi-conscious with that. The serotonin can also cause spasm in the airways, so people can get acute attack of asthma. They'll be often very red and flushed. Now, the things that bring it on can be quite many and varied. One of my patients, in fact, was diagnosed because a whole lot of medical students wanted to come and feel his very big liver, and pushing on his liver was sufficient to release a lot of serotonin into the bloodstream and cause one of these carcinoid crises. But the most common thing to cause it is in fact, either surgery or some other injury where a lot of pressure is put onto one of the deposits. And sometimes it's also described, in fact, with peptide receptor radionuclide therapy, when it's if it's very successful, you can have a release of preformed hormone into the circulation, and so it is one of the potential side effects of this particular therapy. In fact, all therapies can lead to an exacerbation of those symptoms. It's treated in the same way that you'd treat shock. You give fluids to replace the blood volume, and we also give adrenal to try and keep the blood pressure up, but the most effective therapy in the short term is giving the somatostatin analogues, the octreotide, instead of being given in the butt, as most of the patients who are having that would know. It's given intravenously as an infusion, and that can be very effective in turning off the effects of the carcinoid crisis.
Well, thank you so much, Rod, and I know that was probably very challenging to try and give us a 5-second answer, but I really do appreciate it. I do have a question for Nick, if that's okay. Nick, I'm just wondering, one of the questions that we had was if there are factors that we know of that influence the growth rate of particularly pancreatic neuroendocrine tumours and or their ability to spread or metastasize?
So the major factors are really the innate biology of the tumour itself. Most tumours, for example, that are low grade tend to remain low grade, although the pace of the cancer can change over a long period of time. The description of the cake that Rod had demonstrated is that some tumours can be heterogeneous, meaning that within them there can be higher grade elements, and therefore they can actually grow faster. And often that's picked up in some of our investigations. So if you did a CT scan, doesn't really tell you what the function of the tumour is, but if you actually did a gallium-68 PET scan, you'd pick up most of the low-grade disease. And if you did a different type of PET scan, an FDG PET scan, you might pick up higher disease. But back to your question in terms of what actually makes the behaviour different, it's the biology of the disease itself and time rather than factors per se that promote it or anything that an individual can do to promote it. So the natural course of a low-grade tumour would be, if left alone, eventually it would metastasize because that is part of the natural history over a long period of time, although the difference between a low-grade and a high-grade is that length of time. A low-grade disease can be substantially long, years, a decade, etc., and a high-grade disease can change more readily within months to a year. But nothing that an individual can do to promote it, to make it worse, and I guess there are a number of treatments I've indicated that can actually suppress growth.
Well, I guess it's Kate speaking again. Maybe it's reassuring. I'm not sure that there seems to be not things that people will be doing that will be increasing the growth of those tumours at least. And I guess there's more information coming in about ways of managing them from a medical point of view. But thank you very much, both of you, for those very brief questions. And
sorry, I'll just cut in there.
Yeah, sure.
One of the things that's often a misconception is that towards patients get more advanced disease, that there's often the sense that the disease has taken off, that it's growing very rapidly. But it's actually just a function of cells dividing, that one cell goes to 2 and 2 cells go to 4 and 4 goes to 16. And once you get to a certain size, it only takes a few extra doublings of the cells in those cancers to make them quite a lot bigger. And so it's very important, even in advanced stages of disease, if we can stop the cells dividing or slow their division, it can have quite a dramatic effect on the symptoms and the quality of life of patients, even if you're not getting them to shrink, because towards the end of the disease, as those deposits get relatively large, it doesn't take many divisions for them to get to a point where they really compromise the health of the organs which they occupy.
Well, thank you. It's really helpful to know too. So thank you to both of you. I'm actually going to pass the baton on to Simone. So Simone, I'm just turning on your webcam now. Simone's from the Unicorn Foundation, and at some point in the evening I'll actually get the name right. So Simone, it's really great to have you on board, and Simone's going to give us a very quick chef's tour of what the Unicorn Foundation have to offer this community. So thanks, Simone.
Thank you, Kate. I hope you can hear me. I had a little drama with my phone, but hopefully I'm back on track now.
I can hear you loud and clear, so
and
that's good.
And you might be able to see me as well.
I can't see you yet, but I'm hoping that you'll arrive, because I know that it was working before.
Fantastic, and I might hold this up to my ear. So thank you, everyone, and thank you especially to our presenters and also to you, Kate, for working with me on what is been a really exciting thing that we've been able to offer our patients. So just really quickly through, but I just wanted to take the opportunity to speak about the Unicorn Foundation, because I don't get to speak to the patients directly, but and just to let you know of some of the things we're actually, what we're doing, and give you an update on how we can get you involved. So obviously, very quickly, our mission is to assist and support patients and carers, to lobby for access to new and appropriate investigations, to raise awareness both in the general community and medical community, to encourage and support Australian research and projects as well, and to continue to work closely with the medical community and we, with relationships such as with Dr. Nick Pavlakis and Professor Rod Hicks. We really appreciate always their support. Nothing's ever too hard, and they always step up to the challenge. Just very quickly, we've really been working very hard on raising awareness, especially in the medical community, for our patients. This is vital. We pretty much go to every single conference. We're attending the Cancer Nurses Society of Australia conference in July. We have quite a bit of a presence at MOGA, which is for oncologists. So they're all national conferences where, again, we speak with the different specialists and raise awareness that way. You'll see here that this is something that we haven't done before, but we are going to be attending the General Practitioners Conference, and I know that that's been a question of how to raise awareness with the GPs, and I will touch on in a little bit on how some of the projects we're going to be doing there. Last year, we really did try to raise awareness in the general community, especially with the passing of Steve Jobs, pretty much our number one probably known NET patient in the world. We were able to get a lot of coverage on the radio. We did also a lot of newspaper articles, not only in the Herald Sun, and also the Body and Soul section. You may have seen a patient there. We did an outdoor campaign, which we're hoping to still... we've actually just had that also up in Sydney, which is exciting. And this is, again, we've been able to get this through just perseverance and connection. So we don't use our hard-earned money to be putting into this. This is literally through people offering it to us. John also, during this time, wrote, as he counted today, 200 letters to the editor over that time. So pretty much it was evident in each paper, Dr. John Layden's name, about just, obviously explaining that, Steve Jobs didn't die of pancreatic cancer, but actually of neuroendocrine cancer. So we really needed to get that information out there. We hopefully over that time of World Net Awareness Day last year, we reached a audience of about 2 million people, which is very, very exciting and something that we're going to be pursuing again this year. So in relation to what we're doing with advocacy and research, we are currently engaging federal and state politicians. John actually was in Canberra only last Monday, meeting with Professor Chris Bagley, who's the Chief Medical Officer of Australia, and also Senator Richard Denatalia of the Greens, who he was obviously talking about funding for rare cancers, funding for NET patients, looking into, how we can get greater access to the different treatments, including radionuclide therapy. So having an audience like that is obviously really, really vital. Recently, we donated money to Peter Mac for assisting in the purchase of a shielded cabinet, which hopefully will increase the number or again, get better access for people to have this, what could potentially be this life-saving treatment. Obviously, we're working with the Cancer Council in producing this NET patient webinar, the first of its kind, I think, the first of its kind for patients with the Cancer Council, which is very, very exciting. Last year, in regards to GP awareness, we produced a GP survey, which we got about close to 1,000 respondents, just, again, asking them what they knew about symptoms, what they knew about what testing could be done, what they knew about then, moving forward and what treatments were available. With those results, we're actually putting them into a poster and we're taking them over, taking that to different international conferences, and we're also in development of a GP information booklet. So, and trying to get them distributed to every single GP with the help, hopefully, of volunteers such as yourself and such as patients. Again, just quickly going through, we've sponsored clinical oncologists, clinicians through awards, and in July we'll be hosting a conference with the Cancer Nurses Society to look at how we can maybe implement a NET nurse program. Just very briefly, some of the fundraising we've done, this has really purely been through our support network, and so we really are looking to move it into the patients and their support networks, and we have had such an amazing response from that, especially through different runs and the Melbourne Marathon last year, the City to Surf, and every day I'm so excited when somebody logs into Everyday Hero, chooses Unicorn Foundation as their preferred charity, and it's really exciting to see the word getting out there. Sorry, I am going to wrap it up, Kate.
I'm giving you the eye.
I know, it's giving the eye now that I can actually see you as well. Just very quickly, and this is probably the main point, when I actually approached Kate earlier in the year about Cancer Connections, which Cancer Connections is a fantastic resource where people can actually talk to each other in a secure environment. And obviously that's something that I would like to look at moving forward, getting you guys off Facebook, even though Facebook is an amazing resource as well, but getting you into a place which is a little bit more secure and allowing you to be, and for those people who do not feel comfortable speaking on Facebook, they will feel comfortable speaking in the Cancer Connection site. Also, just very quickly, another plug for the patient support groups. Please come along if you can, and I will not touch on that just so that I can move forward. But again, if you would like to see my presentation, I will be posting it onto the website. And do please access the website at any time, because we do try and keep it as up to date as possible. And John's forever working on that net library to try and keep that as up to date as possible as well. So keep in mind, World Net Awareness Day on November 10, we will have something going on in each state. Thanks, Kate.
Thank you so much, Simone. And look, I appreciate everyone hanging in there, and I know that we're right on 9 o'clock. So I'm going to just very quickly, for those of you who can remain with us, just tell you a couple of things, and it's going to be extremely quick. But just to let you know that, and I'm not going to even go through these slides, but just to emphasise that we, most of you will have heard of the Cancer Helpline. So that's accessible throughout Australia by calling the number 13 11 20. And in Victoria, certainly this is staffed by trained cancer nurses, and they can help link you into all sorts of services, including the state neuroendocrine cancer support groups, but also some of our other services. And Simone alluded to Cancer Connection, so I'm actually going to whiz straight onto there. And just Simone and I have had some discussions about whether there is a possibility of forming a private online group on this website. So this website's actually moderated and owned and run by the Cancer Council. So it's a little bit different from Facebook in that it's not a commercial enterprise, and so when you put your data into Cancer Connections, that's actually stored on a secure server with the Cancer Council, and we have the ability to do live chats and private groups in this setting. So it's just something that people might be interested in considering, and what we will be doing at the end of this webinar is actually emailing everyone who's participated with an evaluation survey. So we're really keen to get your constructive feedback about how this has gone for you tonight. Certainly for me, it's been a really big learning experience running our first webinar, and I know that there'll be some things that we learn and take away from and maybe tweak for next time, but we'd really be appreciative to hear your feedback as well. But along with that, there'll be a section at the end where you can actually add your details if you're interested in being kept in the loop about this. So so please do take the opportunity to give us your feedback, and also let us know your contact details if you'd like to be in the loop with further online groups and other supports. I just wanted also to let you know that the Cancer Council have just it's just hot off the press, but we've got a new Understanding Pancreatic Cancer booklet, which includes a new section on neuroendocrine pancreatic cancers. So that's available just by calling the number on the screen, which is 13 11 20 once again. So look, I'm not going to take anyone else's time, but just to say a really heartfelt appreciation to Professor Rodney Hicks, Professor Nick Pavlakis, to Rich Johnston for your amazing story, and for Simone and John from the Unicorn Foundation in partnering with us to produce this webinar tonight. So thank you to everybody who's come on board. I know it's been a new experience for us, and I suspect a new experience for many of you as well. So it's often, this world of technology is often a weird and wonderful ride, and I think we've actually we've managed to get through. So I really do appreciate everyone's time tonight, and yeah, looking forward to keeping in touch with the people who provide us with their contact details. So without further ado, we'll finish up there. But thank you once again, everybody.
Thanks, everybody.
Thanks to you, Kate.
Thanks.
Okay. Well, thanks, everybody. We're going to close the session now, and it will be available. We'll send an email out when it's available. The recording is available for people if they'd like to recap. Thanks, everyone.
Thank
Bye-bye.
you.